what I want to understand from you is, as per you, what are the challenges that you feel as a healthcare provider which are still existing in India, and the solutions to that?
So almost the challenges remains the same since independence. A lot of improvements have happened, but accessibility, affordability and accountability in the care is still not there. Let's talk about accountability. If you see in US, there is a Center for Medicare and Medicaid, which looks after and monitors the treatment because they are the payer. Similarly, for National Health Services in UK, there is a monitoring mechanism, the third party called National Institute of Clinical Excellence. Here, any doctor who comes out, undergraduate, postgraduate, can practice, and then nobody monitors if it is right practice or wrong practice. So monitoring, accountability is limited. Affordability is a problem because with the technology coming in, the cost and it gets catastrophic, and 2.3% of population do go below poverty line because it's costly. The diagnostics have improved, so life expectancy have improved, and the quality of care has improved, but it has become costlier. We'll have to look at that. Access of healthcare, since 1946, Bohr committee had a plan for rural health centers and then bit of urban. Those have remarkably improved, but still there is large population, 68% of the population still don't have a proper access to healthcare. And that is why there are these allied health science, alternate health science people who are the first contact for majority of the places. So challenges are there, but on the same breath I should say that government has done remarkably well. Our healthcare indices have improved significantly. Our life expectancies have improved. Morbidity, mortalities have improved. There is non-communicable disease program has come in, other than the communicable which was already existing. And with vaccinations, COVID, there are lots of indigenization which is happening in medical devices production and things like that. So there has been remarkable improvement, and I think it's on a upstream.
Right. Coming back to the accountability part, we nowadays we hear a lot of medical negligence cases happening in India, and should there be a again a monitoring regulatory kind of organization that be looking into these in these cases? And at this point in time, I mean, you go to an NMC or you go to all these organizations, but the patient is not satisfied. You say that in US there is the outcome based payment model. Payer is paying according to the satisfaction of the patient. Here in India, do you think it needs to come from the payer, or do you think it needs to come from the government, or should there be a balance between both?
So India is a big country, very diverse. So 29 states is almost close to 31 countries. We were just seeing Uttar Pradesh. Uttar Pradesh basically has 25 crore of population. That means Germany, France and UK together. So it's big. The problems are different. Now every model has to work. So government definitely should be monitoring it. So our regulator for healthcare is National Medical Commission. Unfortunately, there is a central pool, and central pool ethics committee have limited people, 12 or 15 people, and they have not put in a practice where they are going to monitor people. A good example is Advertising Society, where they have auto regulated their own advertising. So that is one way of looking at it. So professional societies in healthcare, like Indian Academy of Pediatrics, Indian Medical Academy, Indian Associations of Surgical, they themselves should auto regulate and see that the negligence don't happen rather than depending on somebody else. So National Medical Commission is a regulator for us, and they should play a good role. Government is a regulator. When they pay, like Ayushman Bharat, they are not going to pay if it is not mandatory. So they're going to be a good regulator. There could be a self-regulating professional societies which should come in. And then I think there is a very decent move of having close to 30 hours of training and within a year. So you will continue to medically educate yourself. So every doctor themselves should be also be practicing the ethics or evidence-based medicine practice. So National Medical Commission has introduced these, and I am very hopeful that in years to come there would be a good accountability within the system, and things will be more science-based rather than eminence, experienced or opinion-based practice.
Absolutely, that's great to hear. Coming to the Amrita Hospital now, what are your plans for Amrita Hospital going forward? Any expansions that you're looking at, any new initiatives that you are planning?
So many, within a year of our existence at Faridabad, we have opened close to 550 beds, 100 critical care beds. We have opened almost all 81 subspecialty, all pediatric subspecialty, which is very, very unique. We are also have operationalized our medical school within that year. We have nursing college which is operational. We have allied health science college which is operational. We have a PhD program which is an MD, PhD and DM PhD program which is going on. There's a lot of research which is both basic and clinical research which got initiated within this year. There is a large simulation center, and the large simulation based exercises got initiated. So last 1 year has been extremely hectic. Other than just managing the hospital, we have managed to introduce academics, we have introduced a lot of community based activity, public health, and next 1 to 2 years what we want to do is put in a lot of good practices, like we have introduced clinical audit. Every clinical department will audit their own work and self-regulate. We have added clinical innovation projects, so you need to innovate operational efficiency and clinical work, and we are seeing a fantastic attraction from the clinical faculty. We have introduced clinical indicator program, because generally what happens is nobody talks to the clinicians and they do what they do, and we want to put in a system in place which is professionally managed and put in an accountability system and do an evidence-based practice. There's a lot of work which is happening in the community, where we are adopting villages and looking after their health and looking after the prevalence of the diseases. There's work which is happening in training and education with our own hospital information system and going completely digital. So very, very exciting days ahead. Lots of international good collaborations. Harvard Business School, Harvard Public School, Harvard Medical School have reached out, and there is decent collaboration which is happening with them. So huge learning, very exciting times, and let's see, with Amma's grace, I think we should be doing pretty well.
That's great to hear. Thank you for joining us, Dr. Singh. It's lovely to hear your views.
Perfect. Thank you so much.